There tends to be this push-pull, kind of a power play thing, which is so unnecessary, because if you're a licensed person who can administer medication, why can you not waste? It's sort of convoluted in my mind. It just doesn't make sense. And the bottom line, the biggest problem I had was making people outside of the Cath Lab understand what it is we do, and the fact that we do it as a team.
Oh, yeah, because I remember we even reverted back at one point where I couldn't give report. Yes. Because I wasn't a nurse. And then the nurse who was circulating and, you're doing other things was like, I can't answer these questions. And I'm like, I'll tell you so that you can tell them.
But why make it harder when you're the person? My back sometimes was completely to the patient. My job was to protect the patient, protect their airway, make sure they were sedated enough so they weren't in any discomfort, but also awake enough to be able to cough if I needed them to. Yeah. There's so many moving parts to a cardiac cath lab. So the first thing I had to do was develop an orientation. Yeah. Which I just standardized for every single person coming through the lab. Binder that had checkoffs for nursing, it had checkoffs for scrubbing, it had checkoffs for monitoring, because at some point you should be able to at least be familiar with each position in the lab.